It started about 20 some odd years ago. It's kind of been coming on progressively for a while. I have a real problem with grading. I have a high level of anxiety, and I think that's how my body deals with it. But I started noticing that my gums were receding. My mom, in fact, I was just thinking my mom will be 92 this year, and she's got a full set of her own teeth. You know, I mean, they're all original. I'm thinking, what's going on here? And so over the years, I've noticed the gums were receding, and it just has progressively gotten worse. And with the breaking down of the gums and then the bone structure too, I have just ended up pretty much grinding or gritting my teeth away. I have no enamel left. My dentist, luckily I have a really good dentist who is very into making sure that they're giving you all the information about a possible solution and how to get there. And it said that he had, and patients that he had recommended or referred here, all of them had been really happy. And I want something that looks natural. I don't want to wear chiclets, like we were saying, and I see people who have, I thought about the veneers, and they don't look real, and they look fake. Originally I was going to do just the tops, because the bottom teeth are actually okay. It's more of a cosmetic thing because they've been ground down. But as we talked to when we were here, Dr. K said, I can do that. I can just do the toppy sheet. And she said, but you'll be back in a year because your teeth they can't withstand the pressure from these teeth that you can't destroy virtually. And so she said, you'll be back in a year for the bottom. I thought, oh, I'm probably not going to want to do this twice. My wonderfully supportive husband, he just retired from the fire department. And when he retired, he was able to cash in all his sick time and vacation time. And he said, here, go get your teeth done. So that's how we ended up here. When I was younger, I had beautiful teeth. I was going to say, I had told Dr. K, I was raised in a home that was very aware and conscious of dental hygiene and care. I mean, I was always at the dentist, and I had orthodontics. I had all of it, you know, and beautiful. I had beautiful teeth. Beautiful smile. But I noticed as I was young, as I started probably in my early 20s, early to mid 20s, I noticed that my teeth were all flat, and I thought it looked really awesome. And people would say, oh, your teeth are all the same shape. Do you go in and have them grind them down? I said, no, you know, I didn't think at the time it was me that was doing it. Well, I went to a dentist one time and kind of was saying, oh, you know, people always compliment. He goes, you know, that's not good, right? No. So that was really the first time it came to my attention that this is probably not a good thing. And I have just eventually just ground them down. And so I went from having a really pretty smile and very healthy gums and teeth to kind of having a real big problem. In 2010, I had a really severe riding accident where I fractured my femur and dislocated my hip, and then I had some problems with the surgery. I had total of 3 surgeries by the time it was solved, but in the process almost lost my leg because I had a avascular necrosis developed. During that time, mobility was a real issue, and unfortunately my whole experience bodily kind of was suffering. I wasn't able to spend time at the sink cleaning my teeth and doing that stuff, and I think eventually that part of it too, plus the stress that was involved, it really took a toll on including my teeth. And then it became more and more apparent that I was having a pretty serious problem. One of the things that's been very difficult is because of the fact that my teeth have also shortened up. Every time I eat anything, like if you want to eat like a sandwich that has maybe some, like a deli sandwich, has some nice good French bread or something on it that's a little crusty, my mouth is in such disarray. There's no, you know, when they say, okay, bite down, and see if your bite's right. Doesn't even do it with me because there is no bite. It's just they land wherever they land because they're so torn up. So anytime I chew, I am constantly walking around with blood running off my tongue and, you know, and open sores in my mouth from biting them in the same spot every time. Everything I have to eat, I have to cut into little bites. And I have to, like, I love apples, I love carrots, the baby carrots for snacks, you know. If I do eat them, I have to cut them into little bites and kind of get them in there. It's kind of bad because sometimes I'm on the verge of choking because I can't chew them down enough to to really swallow, and it can be really dangerous. I'm sure that there's been times where I've actually choked because I just wanted to be done with it at that point, and so I go to swallow and I really shouldn't have, and I get choked because it gets stuck in my throat, or things that you don't really think of. Especially if you've never had a person who's never had any dental issues, how hard it is. I love ribs, like, corn on the cob, things like that. And I love ice cream, and believe it or not, I don't eat a lot of ice cream because it hurts. The cold. I'm gonna feel less like a failure, for one thing, because I feel like this is a failure to me. Maybe I don't mean to be melodramatic, but I do feel like that this is a failure. It is what it is. People are the way they are. I see things too, and I fall into stereotypes too, as we all do. But when I was growing up, if your teeth were messed up, there was something about your character that was messed up. If you don't know the person, then you don't know the situation. So either get to know the person, or it's not your business. And you certainly shouldn't make a judgment about something that you don't know, or a person that you don't know. And if you don't, or even if you don't, or you do, or you want to, try to find out what's going on in their life, maybe even, and then get to the root of what might be going on. I mean, there's people that have all kinds of physical, mental, and emotional issues. And really, with me, it was emotional, mostly. Because of the fact that I was so, I was so hard on myself. And so that's what a lot of these things manifested because of that, like my grinding and gritting and all that. It was because it was really deeper than just the teeth. It was because this is the kind of pressure that I put on myself, to be perfect and to have everything just right and to look just right. And that's the other thing about this that is so, I think, revolutionary, is the fact that, knock on wood, this is gonna be it for me now. And it's gonna be virtually, maintenance free.